to dig in on root canals today. Yay! Everybody's favorite topic, right? Well, root canals are super controversial, and I love the controversy. I definitely want to talk all about it. We're going to dig in because I don't know that I fit in either camp completely. So, first question that I get a lot, people ask me this all the time on their podcasts and when I do other interviews. They want to know, are root canals toxic? Or why is there a controversy? Why do people in the holistic space hate them so much? Well, what a root canal is really a stressor on the body. So it's not necessarily toxic, but it can, depending on how it's done, on how that root canal is doing, it can increase the toxic load on the body. So let's talk about what a root canal actually is. A root canal is when we remove the nerve of the tooth. Yay, because that gets us out of pain and it allows us to be able to keep the tooth for longer. But the bad thing about a root canal is that also removes the blood supply to the tooth. And your teeth are like these really intricate sponges. It's not completely hard structure. It's super, super spongy. So when we remove the nerve and the blood supply of the canal itself, where the little space is within the roots of the teeth, then we're leaving all of the rest of that spongy structure that still has teeny tiny little bits of nerve endings, of blood supply, of blood cells, all that stuff. And so when a root canal is done, you've removed the blood supply, you've also removed the oxygen, right? Because blood is what carries oxygen to all of our cells. And when you've removed the nerve, you've removed the blood supply, you've removed the oxygen from an area, then a tooth that's normally inhabited by many different kinds of bacteria is now shifted to where different bacteria tend to like those areas. So it's no longer the oxygen-loving bacteria. Now it's like the deep, creepy, crawly types of bacteria that thrive in a low oxygen environment. Now, does this mean that all root canals are bad? I would say no, because what I really just don't like to speak in absolutes. A patient is an individual, a person is an individual. And so no, I don't believe that all root canals are bad. Now, all root canals can have a potential to be bad. But based on what I currently know, based on the research that I have seen, an infected tooth is worse than a clinically sound and beautiful looking root canal. Because from what I know currently, active infections, chronic infections is something that your body's always having to work on. So can you have a root canal that was very well done, that is clinically sound? Can you have that be a normal functioning part of your body? I would say yes. It's maybe is it ideal? No. It's the lesser of evils, but I think that it can still serve its place. Now, if I have a patient who is choosing to have a root canal done, do I want just any Joe Blow general dentist to do that root canal? Absolutely not, because there is potential for problems. There is potential for issues. So if you're going to have a root canal done, I would say absolutely. I want that done in the hands of somebody who does root canals all the time. They are clinically excellent at what they do. And I would say they at least uphold the standards of care, which is they use a microscope, they use a rubber dam to isolate the area. And then hopefully they are doing some of these things that go beyond the standard of care, like ozone and lasers and things like that, that can just boost the ability for the practitioner, for the dentist, to disinfect as much of that tooth as possible. That's ideal if you have to have a root canal done or if you choose to have a root canal done. No one ever has to have a root canal done. Now, why do my naturopathic friends, why do my functional medicine doctors, why do the people with really large audiences on the internet, why do they hate root canals so much? Well, it's because those creepy crawly bacteria are potentially causing problems for some people. Just like any toxic overload, if that is something that fills your bucket, your toxic capability bucket, to where it's full and then overflowing, then maybe in certain people, in certain circumstances, maybe a root canal then coincidentally leads to, well, I won't even say leads to, because I can't say that with certainty. I would say there are some people who have a very high toxic load and they have systemic illnesses or systemic symptoms that coincidentally happen after a root canal is done. And sometimes people also, maybe the same people, maybe different people, sometimes people have a resolution of their symptoms elsewhere in the body that coincidentally happens after a root canal tooth is removed. So I'm hoping I'm making that clear, that these are interesting coincidences. Let's put it that way. Interesting coincidences that sometimes systemic illness, systemic symptoms will pop up after a root canal is done. And likewise, sometimes systemic symptoms, systemic illnesses will mysteriously go away or lessen once a root canal is removed or retreated or something like that. So that is why it's a really fun, interesting area to study. And I'm excited that there's more and more research coming out. So let's dig in a little further because all the controversial stuff is all the stuff that you see, all headlines, root canals are bad, root canals are evil. Well, that's not what I deal with on a daily basis. I deal with you. I deal with you in my office, a single person who is very much an individual. And what happens if you need a root canal? So let's talk about what happens if you need a root canal. I'm going to actually give you some questions on what to ask your dentist if you're told you need a root canal. Need, it's a very relative term, very broad. If your dentist says you need a root canal, then the very first question you want to ask is, why are you recommending that I get a root canal on this tooth? You have to know why, because there are many different reasons why. Some I agree with more than others, but you want to be able to ask the right questions so you can make the best decision for yourself. First reason, the nerve is necrotic or the nerve of the tooth is dead. That's reason number one. So this tooth likely won't have any symptoms, but the necrotic root is leaking infectious matter around the root into the bone and therefore into your bloodstream. So these types of infections are filled with the same bacteria that can inhabit blood clots that cause heart attacks. So it might not be in your face urgent. You definitely want to address the situation for your overall health. So some follow-up questions. If your dentist says the nerve of this tooth is necrotic or the nerve is dead, then you want to ask, how much bone have I lost around this tooth? Is the infection affecting the neighboring teeth? How urgent do you think treating this tooth is? And what will happen if I do nothing? Those are important questions that you definitely want to ask. The second reason would be irreversible pulpitis. That's the fancy diagnostic term, but basically the nerve is dying a painful death. You will know if this is happening. So this is noted by intense pain that happens out of the blue. So we call this spontaneous pain. You might have throbbing, lingering pain that lasts for minutes or longer. It's not just over in a few seconds. It's sometimes accompanied by fever and swelling. Like I said, these infections are no joke, and you might need to take an antibiotic before you can even treat the tooth. But it's urgent, and you are not going to want to ignore it. But I would say be very careful when you make any kind of decision while you're in severe pain, especially if it doesn't align with the values you held before you were hurting. If you were very strictly in the, I will never get a root canal, I'll never have a root canal in my mouth. If you're in that camp and now suddenly you're begging to have one done, then please, please, please run this decision by a friend or a loved one who can help you rationally go through your options. It's really hard to make decisions when you're hurting. Follow-up questions that you can ask are, should I take antibiotics before having treatment? How soon do I need to make a decision? What will happen if I take antibiotics and I start feeling better? Will I still need treatment? And what are my other options? Always ask, what are my other options? Do I have any other options? There are always going to be options beside a root canal, and it's just a matter of laying out what those options are and choosing the one that makes the most sense for you. The reason 3, you might get told you need a root canal. The nerve is inflamed, called reversible pulpitis. So before we talked about irreversible pulpitis, this is reversible pulpitis. And as the name suggests, this condition is technically reversible, but it may be really a no fun time marked by pain that can be kind of intense. But the pain is only brought on by chewing, cold, pressure, and the pain ends almost immediately after you take away the painful stimulus. This situation does not need a root canal yet. The nerve in this case can still heal, but your dentist may plan for one if they feel the tooth is going to worsen instead of get better, or if you have been particularly distressed about your symptoms. Yes, yes, yes. Sometimes your reaction to your symptoms can make good dentists suggest treatment that might not be clinically necessary. So it's important to ask lots of questions if this might be you. Questions that you can ask are, what are the chances this tooth will heal without a root canal? Are you suggesting a root canal because it's clinically necessary, or more so because I'm upset? Just ask the question. Have honest conversations. Ask, how long can we wait this out and see if it heals? And is there anything else we can do to try to avoid a root canal? Hopefully you've got some other choices, so then you can make a rational decision. Again, just ask questions, be honest. If you're having a rough time, if you've got a tooth that's crazy sensitive and every time you bite into something cold, it gives you this intense zing of pain. If you're really upset about it and you feel like, my tooth didn't hurt before this dentist worked on me, and now it hurts and I'm upset, then it's very possible that that could cause a dentist to lean one way or the other, and they might suggest a root canal just to get you out of pain and get you feeling better faster, when maybe it might not be clinically necessary. So ask the questions, have the honest conversation. Next reason that your dentist might tell you that you need a root canal: there's large decay in the tooth approaching or into the nerve of the tooth. So the dentist is assuming that while removing the decay, they're going to expose the pulp chamber and the nerve of the tooth. Once that happens, most of us were taught that the nerve has been irreversibly damaged and the tooth needs to be devitalized at that point, needs a root canal. This is absolutely a judgment call by the dentist, his or her experience, and how aggressively he or she wants to treat you. Many times dentists want to plan for the worst, but hope for the best in their treatment plans. And who can blame them? Because nobody likes needing a root canal, but a surprise root canal is even worse. So this is sometimes the kindest way to proceed. But you definitely want to ask questions. So questions to ask here are, how sure are you that this tooth will need a root canal? Is an indirect pulp cap an option here? And we can talk about indirect pulp caps here in a second. If we try an indirect pulp cap, what are the chances that I'll still need a root canal? So when I refer to pulp caps, this can sometimes be a really good option for people when there is decay that's really, really deep and close to the nerve of the tooth. So a direct pulp cap is when we remove decay, and that means that we remove so much tooth structure that we actually expose the nerve, meaning I see red when I'm drilling on the inside of the tooth. So then we place a lining material on that little pinpoint exposure, and the liner is usually made of calcium hydroxide, various other things that help the tooth hopefully repair itself and insulate the nerve of the tooth. It's like a little blanket. An indirect pulp cap, just like the name implies, is we are indirectly placing the same lining material over the tooth structure that is right on top of the nerve. So we don't actually get into the nerve. We don't see red, but we might see pink where the tooth dentin, that second layer of tooth structure, is so thin that we're just really, really close to the nerve of the tooth. An indirect pulp cap, as you would think, is statistically more successful than a direct pulp cap. A direct pulp cap means we've already exposed the nerve of the tooth to the bacteria that's in the decayed part, the icky part of the tooth. Indirect pulp cap can do very, very well. And a lot of times the tooth will heal up just fine. And in fact, I would say more often than not, the tooth then goes on to heal and the nerve is perfectly functioning and everything's doing just fine. So ask those questions. Ask if a pulp cap or an indirect pulp cap might be an option in this scenario. The fifth reason that you might need a root canal, or you might be told that you need a root canal, is you're in the middle of dental treatment and the dentist says that the decay went farther than he thought, and now you need a root canal. Ugh. We all hate when this happens, but it's a possibility whenever you have dental work done. It's going to be most likely listed as a potential complication in that little consent form that you signed, but probably didn't read. And it's listed as a complication for a reason. It's really important here to ask the dentist to stop the procedure for a moment so that you can discuss and see what your options are. Now, hopefully they were able to predict this or tell you that this was a possibility, but if you didn't have that discussion beforehand, now's the next best time to have that discussion. And if this has happened to you and you're really uncomfortable with proceeding, just ask the dentist if he or she can place a temporary filling in the tooth for you so that you can gather your thoughts, evaluate your options, and make a good decision. And just ask, is a direct pulp cap an option here? Did you expose the nerve of the tooth? And just see what your options are. So regardless of the reason that your dentist recommends a root canal, there are some other questions that you may want to ask. Like I said before, what are my other options? If your dentist uses ozone, is ozone an option in one way or another? Ask about pulp caps. Ask, are there any other options? Is removing the tooth an option? So just see, what are your other options? That's really what the dentist wants to give you, is informed consent. And informed consent means all of your options and are comfortable making a decision based on those options. Ask, what will likely happen if I do nothing? It's an important question, but what do they think is most likely to happen if you do nothing to that tooth? If I pull the tooth instead of doing a root canal, what are the risks involved? Make sure they go over those risks for you. If I take antibiotics, but then I don't do the root canal, what will possibly happen? Most likely, they will tell you if you do antibiotics and then don't do the root canal, you're just going to go on this cycle where it flares up, it feels bad, you take antibiotics, it calms down, it feels better, and then you repeat that process every couple of months. What is the chance in percentage, because I like percentages, that this tooth will heal without a root canal? What might I do at home to help it along? Right? It's a good question. You want to know, is there anything that you can be doing? Sometimes when patients ask me that question, I'll say, I don't like the way your symptoms are going. This is maybe a 50-50 situation. You can help boost along your immune system by eating things that are anti-inflammatory. If you take any supplements, take nice, good anti-inflammatory supplements like vitamin C, turmeric, garlic, fish oil, omega-3s, things like that. Anything that will help your immune system respond better can be very helpful. Because ultimately, as dentists, it's our responsibility to make sure that you are given informed consent before you receive any dental treatment at all. Sometimes we gloss over the parts that seem a little unpleasant. We gloss over things that sometimes we shouldn't gloss over, or maybe we assume too quickly that you understand what's involved. So I just encourage you, ask questions, especially if you don't feel comfortable with the recommendations that you've been given. And if at all possible, pause on any treatment until you feel like you understand your options and you feel good about your decision. And it's not always possible pausing on a tooth extraction after they've already gotten the tooth loose, and that's not really a viable option. Usually we're going to want to keep going. But if at all possible, just take pause, pump the brakes just a little bit, and make sure you feel good about your options before you proceed. All right. Hope that helps, guys. And we will talk to you soon.